My name is David Watson. I'm going to do oral competency of the skeletal system. I'm going to identify the bones, a few bony landmarks starting from the superior skull down to the inferior, your final phalanx. So starting on the anterior portion of the superior skull, you have your frontal bone. Moving posteriorly, you have your parietal bones. Your parietal bones fuse with your occipital bone, which is the posterior portion of the skull. Where the occipital protuberance and the superior nuchal line is, an attachment point for several neck muscles. So moving anteriorly along the lateral side of the skull, you have your temporal bones on each side, and further anteriorly, the temporal bone connects to the sphenoid bone and the zygomatic bone, which is your cheekbone. Your cheekbone fuses with your maxilla bones. Deep to your maxilla is your palatine bone. In your nasal cavity, you have that thin vomer bone, and your inferior nasal conchi bones. The most superior portion is your two nasal bones. Moving into the orbit, so laterally and deep into your orbit, you have your lacrimal bones and your ethmoid bones. Moving, so to your jawbone is your mandible, and located deep to your jawbone, although not present in this skeleton system or skeleton model, is your hyoid bone or your throat bone. You have your so on the posterior side of the skeleton, you have your vertebral column. You have the first seven vertebrae are your cervical vertebrae. First one being your atlanta, second being your axes, C3, C4, C5, C6, C7. Then you have your 12 thoracic vertebrae, which each have a joined-in pair of costal bones or ribs. So starting from the superior T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. So at the bottom, or the 5 lumbar vertebrae follow inferiorly to your thoracic vertebrae, L1, L2, L3, L4, L5. L5 articulates with your sacral vertebrae, which fuse to form your sacrum, and your inferior to that is your coccygeal vertebrae, which fuse to form your coccyx. So moving superiorly again, you have your shoulder girdle, you have your clavicle, that's the S-shaped bone, and your scapula. Some bony landmarks are your superior angle and inferior angle. You have the spine of scapula, and you have your glenoid fossa, which is the articulating point of the scapula with the humerus, or the head of the humerus. Humerus has on the lateral side, a greater tubercle, and medial to that is a lesser tubercle with an intertubercular ridge in between. You then have your shaft of humerus, which moves down, and the articulating point of the humerus is your trochlea in the trochlear notch of the ulna. So the ulna is the medial long bone, radius is the lateral long bone. Your radiocarpal joint is made of the radius and your carpal bones, which will start on the lateral side or your thumb side. You have your scaphoid moving medially. You have your lunate. Continuing, you have your triquetrum and then your pisiform. Distal to your pisiform, you have your hamate, which has the hook of hamate as an identifying feature, and you have, moving lateral from that, you have your capitate, your trapezoid, and then your most lateral is your trapezium. Distal to your carpal bones are your metacarpal bones, your first metacarpal bone being at the base of your thumb. So you have your first metacarpal, second, moving medially, third, fourth, and fifth. Starting at your lateral, your thumb, you then go into your digits. The thumb is unique in that it only has a proximal and a distal phalanx. So proximal and then distal to that is your distal phalanx. And then the medial 4 bones have 3 phalanx bones, which are the proximal phalanx, intermediate, and the distal. So same thing, you have your first, second, third, fourth, and fifth set of digits. Moving back to your sacrum articulates with your ilium, which is one of 3 bones that form the coxal bone. You have your ilium, you have your ischium, which you can identify with the ischial tuberosities, which is what your sit bones, and then your pubis bones, which articulate in the anterior portion at the pubic symphysis. So in the acetabellum of the coxal bone, you have the head of the femur. The femur, different than the humerus, has more pronounced bony landmarks, which is on the lateral side, the greater trochanter, on the medial side, the lesser trochanter. Then you have your shaft of femur. Your femur articulates with the patella bone and the tibia. Your tibial tuberosity is a prominent feature. Your pes anserinus attachment site is an additional, just medial to that feature. Then you have your lateral bone, which is your fibula. Your tibia and fibula articulate with the talus bone, which is one of your tarsal bones. You have your medial malleoli at the distal portion of the tibia and the lateral malleoli at the distal portion of the fibula. So your talus bones are, you have your talus. Posterior and inferior to that, you have your calcaneus. Your talus articulates with your navicular, which is the long rectangular bone. Your navicular articulates with your three cuneiforms. So starting from the medial portion, you have your medial cuneiform. Intermediate, moving laterally, you have an intermediate cuneiform, and then your lateral cuneiform. Your lateral cuneiform and your navicular articulate laterally with the large cuboid tarsal bone. Now the cuneiforms and the cuboid articulate with your metatarsals. Similar to your hands, the first metatarsal will be the big toe, so that's the medial metatarsal is your first. Second, moving laterally, third, fourth, and fifth. Your distal to your metatarsals is your phalanges, bones of the foot. So your first or your big toe is your proximal phalanx, and distal to that is the distal phalanx. The lateral four bones have three phalanx bones. Your proximal, distal to that is your intermediate phalanx, and then distal to that is your distal phalanx, and that's the same for the lateral four bones. In case I think I forgot, so you have your manubrium and your sternum, or your manubrium is the superior portion of the sternum, and the xiphoid process is the inferior portion of the sternum. Your sternum articulates with 7 pairs of true ribs. They're true because they articulate with the sternum directly through the costal cartilage. The final 5 pairs of ribs are called false ribs, which you have 1, 2, 3, 4, and 5, with the last 2 pairs being floating ribs because they do not have a cartilaginous connection point. So that is my oral competency of the skeletal system. Thank you.